Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Join us for an important session dedicated to understanding the role of chemotherapy in the management of gastric cancer. This session holds profound significance for those navigating the complexities of cancer treatment and their families. Chemotherapy remains a cornerstone in the fight against gastric cancer, offering hope and vital insights into treatment strategies. Together, we aim to empower patients with knowledge and support, providing clarity and guidance through this challenging journey. Your participation promises to shed light on crucial aspects of care, fostering resilience and informed decision making. So let's come together to explore and discuss how chemotherapy plays a pivotal role in enhancing outcomes and quality of life. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we are here to explore a topic that directly affects those undergoing gastric cancer treatment. And to guide us through this essential discussion, we are honored to have with us the esteemed Dr. Sandeep Ganguly, whose expertise in this area will shed light on the complexities of chemotherapy as a key treatment option. Dr. Sandeep Ganguly is a highly esteemed medical oncologist with a profound impact on cancer care, currently serving at Apollo Multispeciality Hospital in Kolkata. With extensive experience in the field of oncology, Dr. Ganguly is renowned for his expertise in systemic therapies across a diverse spectrum of malignancies, including breast, gynecological, gastrointestinal, and thoracic cancers. His clinical acumen is matched by his active role in research, where he serves as the primary investigator in numerous global clinical trials, driving innovation and progress in cancer treatment. Dr. Ganguly's dedication to advancing field is reflected in his prolific research contributions, with numerous publications in prestigious PubMed Index journals. These publications not only demonstrate his commitment to improving patient outcomes, but also establish him as a thought leader in oncology. His work has significantly influenced both clinical practices and the broader landscape of cancer research, earning him the respect and admiration of his peers. So his commitment to providing cutting-edge treatments, combined with his compassionate approach to patient care, has solidified his reputation as a leading oncologist in Kolkata. Sir's unwavering dedication to his patients and the field of oncology continues to inspire and set new benchmarks in cancer care. Dr. Sandeep Ganguly, THIP Media welcomes you, sir. Thank you so much for joining us today, sir. And so we all understand that chemotherapy, it plays a very crucial role in the treatment of any cancer, especially, let's say, gastric cancer. Yet many patients and their families, they may feel overwhelmed by the idea of undergoing chemotherapy. So with this in mind, sir, I'd like to begin our discussion by addressing the most fundamental question, that what exactly is this condition of gastric cancer? I mean, could you help us understand the causes and the risk factors, the ones who could actually, or people who are at a higher risk of developing the condition?
Gastric cancer is a cancer which is arising from the stomach or
Right.
from the gastric, which we call as a stomach cancer also.
Right.
The risk factors associated with it are mainly modifiable risk factors,
Right.
like consumption of tobacco smoking, consumption of alcohol consumptions, then high intake of high salted foods, like smoked
Okay.
or salted foods. These are the most common risk factors. One of the most common risk factors is also like poor hygiene.
Okay.
Like if we get infected with a infection, like if we are not maintaining a proper hygiene, we can get ourselves infected with a bacteria called Helicobacter pylori or H. pylori,
Right.
from which chronic gastritis can arise. And this may lead to a cancer also. So H. pylori can also cause a gastric cancer. It
Right.
not only causes gastric cancer, it can also cause us a gastric lymphoma also.
Okay.
And very rarely, around 3% of the cases, gastric cancers are hereditary, means it can be run in the family. But most of the time, what we see is a consumption of the tobacco or alcohol consumption and H. pylori infection leading to a poor hygiene, persistent gastritis, which can cause gastric cancer.
Okay, right, sir. And what would you suggest are the most common symptoms? Like, even if there's bad hygiene, and you've given us a very long list, or even it's a familial cause. But I'm sure there must be certain warning signs that one could actually understand and would visit a doctor. And if one does, how is gastric cancer, typically diagnosed by a doctor?
Unfortunately, most of the symptoms of gastric cancer in the early stages get confused with our normal acidity. Like we
Okay,
sometimes feel acid reflux, indigestion, pain abdomen. So we tend to delay the diagnosis of gastric cancer because we try to think that this is a normal acidity, acid हुआ. So we try to take a normal over-the-counter medications like the PPIs or Sucral and all.
right.
So many times because of this, there is a delay in the diagnosis. And in the later stages, the pain abdomen can worsen, really worsen. And sometimes the tumor may bleed inside the stomach,
Right.
which may cause vomiting out blood, or the blood may come out from the stools also, which we call it as a black stools. That is
Okay.
called as a melena.
Okay.
And then also they can have associated weight loss is there. And if the tumor has gone to the other organs, then symptoms can manifest because of that also, like bone pain. If the tumors have gone to the lungs, they can have a cough. If the tumors have gone to the liver, they can have jaundice. But most
Okay.
of the time, the symptoms are early symptoms like acidity, indigestion, pain abdomen, which we normally think that this is normal acidity and delay it. So unfortunately, that becomes a late diagnosis. Diagnosis is mainly by an endoscopy. We should get
Okay.
an endoscopy done where we put a tube through our mouth, inspect the stomach and the esophagus.
Right.
And if there is a tumor, we take a biopsy, and that's how we diagnose gastric cancer.
Okay. Right, sir. And once the diagnosis has been confirmed by a doctor, and you just mentioned that early diagnosis usually is a little difficult to detect the condition. So I'm going to come to the topic now that we wanted to discuss is chemotherapy. So what role does chemotherapy play in the overall treatment plan for gastric cancer, particularly for the ones, and so I'm sure the ones who have come at a later stage?
Chemotherapy plays a very important role in both in the early gastric cancers and also in the later stages of gastric cancer.
Right, sir.
Because one thing we should remember, cancer is a systemic disease.
Right, sir.
Because people think that if the tumor gets operated in the early stages, then why the person should receive chemotherapy? But
Okay.
studies have shown that if we do not give chemotherapy, the disease comes back very fast because the
Okay.
cancer cells are there in the blood circulation. So
Okay.
that's why the chemotherapy is there required in the early stages. And initially, we used to give after the surgery, but now we are giving chemotherapy before surgery also and after surgery also to
Okay.
cure the patient. So that's why chemotherapy plays a very important role to kill the cancer cells in the blood
Right.
vessel or in the blood circulation.
Right.
In the advanced stages, chemotherapy is given mainly to control the disease. Obviously, we cannot eradicate the tumor. Like if the tumor unfortunately has metastasized to the bone, liver, then we cannot do surgery. So we
Okay.
can give chemotherapy to control the disease, control the symptoms, and also improve the survival. So that's why chemotherapy plays a very important role in the gastric cancer throughout the spectrum, from a localized disease to a advanced disease also.
Okay, right. And after understanding this was really, really revolutionary that it is involved both prior and after the surgical procedure. So may I know that how effective is chemotherapy in improving the survival rates and quality of life for gastric cancer patients?
For in localized cases, like if we do not give chemotherapy after a surgery, the disease may come back very fast in 3 to 4 months or 6 months.
Okay,
But with chemotherapy, we can make some patients cure from the disease also. And some patients may get the disease back after 2 years also. So the disease-free survival increases to around 2 years.
okay,
And for metastatic cases, like suppose for a stage 4 stomach cancer, we do not give any chemotherapy.
okay,
The average survival maybe, unfortunately, maybe just 2 to 3 months. But with chemotherapy and now with the available targeted therapies and immunotherapies, we can improve the survival to more than a year also. So
okay,
chemotherapy, targeted therapy, immunotherapy plays a very important role in the management of gastric cancer.
okay, right. And what would you say are the common side effects and risks associated with chemotherapy for this particular cancer?
The chemotherapy side effects most of the time are transient, like they are
Okay,
temporary, because once we
okay,
stop the chemotherapy, the side effects get resolved. The
right.
side effects may be like, fortunately for gastric cancers, in the first line, what we use, many patients may not lose the hair. Like
Okay.
they may not lose the hair. So hair
Mm-hmm.
loss, even if it happens, is transient or temporary. They can have some nausea, fatigue. They can have some weakness. Sometimes diarrhea can happen,
Okay.
and also the WBC count may go down during the chemotherapy, which may make a person susceptible to develop fever and infection.
Okay.
So that is one of the most common side effects. And some late side effects are like something, because the nerves of our body may get damaged because of the chemotherapy.
Okay.
Because of that, they can have some tingling, numbness,
Mm-hmm.
but it does not affect the quality of life that much. And because if the patient develops the symptoms, they should consult their doctors, who will
Right.
adjust the dose of chemotherapy so
Right. So,
as to reduce the side effects of the chemotherapy. So well tolerated, not a very harmful thing. It's well tolerated.
okay. Right. And I'm sure, sir, all cases, I mean, chemotherapy might not be applicable for all cases, right? So, are there
True.
any contraindications or special considerations when you're prescribing chemotherapy for gastric cancer patients?
Yes, because obviously in oncology, one size does not fit all.
Okay.
So we have to assess many things. One is obviously the age of a patient. Like
Okay.
a elderly, frail person may not tolerate the chemotherapy to that extent compared to a fit young individual.
Okay.
Then also we look at the patient's fitness, like whether the patient is able to do his daily activities regularly or not.
Okay.
Because a patient who is bedridden may
Okay.
not tolerate the chemotherapy to that well.
Okay.
Then also we look at the patient's organ function to see whether
Mhm.
the patient's liver and the kidney are functioning normally or not,
Right.
because these drugs get destroyed in our body through the liver or the kidney functions. So
Right.
we have to adjust the dose accordingly. And
Right.
also we have to look for the heart's ability to pump blood, the ejection fraction, because if they are really weak, some chemotherapeutic agents we cannot give. So we have
Mhm.
to tailor the therapy based on all this, like the patient's age, nutritional status, fitness, the liver and the kidney functions and the heart functions. Based on this, we modify the dose of chemotherapy.
Okay, so that's how we decide the treatment plan or the regimen for the
Yes,
patient.
yes.
Okay, sir. And what are the key safety measures, taken to manage? You just mentioned a couple of side effects, which may be transient, but are there of chemotherapy in gastric cancer patients?
The side effects,
Yes,
how
sir.
to manage the side effects.
Yes, sir.
Simple. One is they should be, if they have developed any symptoms, they should report to the doctor immediately.
Right,
Because the fever, for example, if they delay it, or diarrhea, if they do a delay in informing, it can be life-threatening.
right.
So if they have any side effects, they should inform the doctor properly, immediately. The other side effects can be managed because one is to eat well, eat a nutritious food. Obviously, because of the cancer, they may not eat a large amount at one particular time. It's advisable to break the meals frequently so that they can take a small amount of food at a much shorter interval, which may
Right,
help them in digesting food. Then obviously hygiene, because we do not know how the outside foods are made. So better to have a homemade foods.
right,
And in homemade foods, they can have anything. Like there is a misconception that sugar increases cancer. No, there is not no such evidence.
right.
Sugar can increase diabetes, but ingestion of the sugar does not cause cancer per se.
Okay,
So these are the most common side effects they should. And the other thing is, many of the side effects are occurs because of the lack of psychosocial support.
right,
Like people secluded them in a single room, allows no one to meet them,
right,
allows them to eat in a separate table in a separate plate. I
right.
think it's not. This is a very wrong practice because
Okay,
cancer is not a contagious disease. They
right,
should meet and mingle with the family members.
right.
And I think if the mood is okay, then the side effects also will be less. Because I do get in my practice, like many elderly people have told, like, can they touch their grandson or granddaughter?
Mm-hmm.
I think they should easily mingle with them because they should lead a normal life.
Right. That's a very wonderful thought, sir. And like you just mentioned that the psychosocial environment and the mindset up of the patient is of utmost importance here. So how can patients and their families, I mean, you must have been coming across a lot of anxious families, be better informed about the benefits and risks of chemotherapy for gastric cancer, or let's say any cancer?
I think the first visit between the doctor and the family is the most important, because in that
Right.
visit, people should be told about the side effects of the chemotherapy and also the how to manage it. And
Right.
whatever doubts the patient or the family have, they should ask clearly.
Right.
And other thing is there will be many noises in the social media or through the neighbors or some distant relatives and all. So I always tell them that filter it as much as possible,
Right.
because in India, people love to give free advices very easily, but in
Yes.
my but if you ask them to donate 1 unit of blood for the patient, they do not. So I think it's
Yes.
better educate them properly, and obviously tell them that it's not a contagious disease. They should
Mhm.
lead a normal life, and I think that's the way we should tell them. The
Okay.
first is the communication with the patient and the family should be proper, and it has to be extensive so that they because they have many doubts. There are lots of information available in the net,
Mhm.
so some are true, some are false. So they should clearly consult with their doctors and clear it as much as possible.
Right, right. So I'm going to summarize this beautiful session on a very positive note of health literacy and awareness from your end, sir. So, what strategies can be employed to raise awareness about the importance of early detection and treatment, which involves chemotherapy for gastric cancer?
Early detection and this thing is if anyone develops the symptoms of acidity or this thing, and if it is not resolving over a period of around 2 weeks or 3 weeks, they should consult their doctors.
Right.
Even if they do not have the other symptoms, it's better to consult the doctors, because if a gastric cancer is detected at an early stage, the chance of cure is much higher
Right.
than if a patient get diagnosed at an advanced stage. So early detection of symptoms and reporting to the physicians is very much recommended. There is no screening for gastric cancer. Like
Okay.
for breast cancer we have, but there is no screening for gastric cancer. So that is not suggested. And obviously educate them about the risk factors, like not to consume tobacco, not to consume alcohol, try to have a proper hygienic food and environment. So
Right.
these are the factors people should be aware of so that they can reduce the risk of gastric cancer. And even if they develop some warning signs, they should report to the doctor immediately.
Right. So open communication, family support, and I think talking to your doctor very, very clearly. That's a beautiful message, sir. And I think you've really, really shared some really enlightening information. I'm hoping that this would be very helpful and very, very valuable to many families. So thank you so much.
Thank
Thank
you.
you so
Thank you.
much.
Bye. Bye.
Thank you, sir. It's really been a pleasure. And
Sure.
for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.
Thank you. Thank you.